The treatment of kidney stones. First and foremost, do a sonography to find out the size, position and number of stones. That is called as the stone load. Then you decide what to do. The main thing would be hydration. That would clear out the crystals and small stones which are stuck in the ureter, the kidney pipe, and also reduce the increase in the size of the future stones. So increased fluid intake around 4 liters of water, 6 liters of water daily would usually be a lifelong management for this patient. The second would be the citrate salts. Sodium citrate, potassium citrate, magnesium containing salts. All this will help reduce the formation and expansion of the stones, and this is also continued most of the patients for lifelong. If the patient has a kidney stone which is small in size, around 2 mm, 5 mm, then these all can be continued for a long time. And once a year sonography and or CT scan may be prescribed, advised as required for the patient by the advice of the nephrologist. If the medium sized stones are there from 5 mm to 10 mm, that is 1 cm, then the urologist surgeon may decide on doing ESWL, that is extracorporeal shockwave lithotripsy. Thereafter, if the patient is having fragments, then those can be continued to be managed with hydration and citrate salts as required. If the patient is having a large stone and it is accessible, then it can be treated, managed by cystoscopy through the urinary place, and then reverse powdering of the thing by RIRS, and finally removing the powder by clearance. Thereafter, a DJ stent, double J stent is inserted into the ureter, and that helps in reduction of the swelling of the kidney if there is any hydronephrosis, hydroureter, and the infection also settles, the creatinine also comes down, and once a year the sonography is continued to be seen. The DJ stent is usually removed after 1 month of insertion. Sometimes some patient requires a DJ stent reinsertion because of stricture or recurrent stone formation. Thank you.